You might be interested in getting a Brazilian butt lift, a BBL, but you want to know what the scars are like. So let's talk about it. Remember, a BBL is a combination of liposuction, which removes fat, and then fat injections that can make your butt or your hips rounder or larger or just change the shape. So the scars that you're going to get from that procedure are going to be directly related to the liposuction. Liposuction is done with small cannulas like this. So very thin tubes. So all I need to do in terms of scarring is just make a little dot, just big enough for this to go in. When I'm done with the procedure, I'm going to put a little stitch in that hole. So what you end up with is a tiny little line that's just about 2 or 3 millimeters long. The amount of those dots that you're going to need will depend on where we're doing the liposuction. So if I'm liposuctioning the belly, I have to make dots in a certain place that allows me to do good liposuction. If I'm doing liposuction on the back, I need to make similar dots on the back to allow me to do good liposuction. Now, as a plastic surgeon, I'm obviously very concerned about scars, not just how they look, but also can we hide them? So I will specifically put those dots in places that are easily hidden. So for example, if I'm doing liposuction on your belly, on your abdomen, I'm going to make a dot in the belly button so you won't see it. I'll make a dot usually below the underwear line. And then often, if I need to get fat from this upper part of the belly or kind of on the side by the bra lines, I'll make a dot under the breast in the crease. So those are all really good places to have a little tiny scar. For the back, you might have a dot in your butt crack, which is obviously very hidden. Or if I need to lipo the upper back, I'm going to put that dot where your bra line would sit so that it'll be hidden. Sometimes to put fat into the hips or even take fat out of the inner thighs, you might need little dots underneath the butt in the crease. But again, the point is I'm very aware of where I can put these dots and where you can get little scars and still have it be hidden with underwear, clothing, little bikinis, or anything you want to hide it. So the scars you get from a Brazilian butt lift is nothing like the scars you would get from a tummy tuck, which could be hip to hip. These are tiny little dots that are easily hidden. Nobody should notice them. Of course, you're going to know where they are, and I'm going to know where they are, but other people shouldn't notice them. So now you have small scars that, like I said, is easily hidden, but you still want to make them look as good as possible. As you probably know, scars continue to get better over time, so they will absolutely fade. Now, I can't promise that scars will disappear because scars are scars and they're there forever. But over time, they will continue to fade to the point where hopefully they're barely noticeable. There are certainly some things you can do along the way to help promote good scar healing. One way is to use a product like this, which contains silicone. This is a silicone gel that's put over the scars. Silicone has been clinically shown to help decrease the appearance of scars. It makes them flatter, it makes them lighter, and makes them less visible. I recommend that my patients start putting a silicone gel scar product on their scars starting at about week 2 after surgery. So we're putting it on while the scar is still pretty fresh, and then continuing that really for about 6 to 9 months. The other thing you want to do is you want to protect that scar from the sunlight. The ultraviolet rays from the sun will make a fresh scar look darker, and that darkness can last longer. So if you want to keep your scars light, keep them out of the sun. That means apply sunscreen to your scars, even if you're wearing clothes, because the UV rays will penetrate your clothes and will still affect the way the scar looks. The third thing that you can do to make your scar heal as nicely as possible is use a laser. There are lasers that are designed to improve the appearance and quality and texture of scars. Again, we like to treat scars early on. So I like to start laser treatments on scars usually within the first 3 to 4 weeks. That way we're treating the scar before it gets bad. If you wait until you have a bad scar, it's often harder to make the scar look better. There are some things that can be done, like steroid injections, or sometimes we even cut out a scar. But in general, if a scar is already thick and looks bad and it's been a year since your surgery, it's hard to reverse that. So you really want to start protecting the scar early with scar gel, with sun protection, and possibly laser treatments. I'm Dr. Matthew Schulman, board certified plastic surgeon. Hopefully you found this video helpful. and maybe you're not so scared of having a BBL because the scars aren't so bad. If you enjoyed this video, make sure to like, comment, and share. And as always, check out the other videos on my channel.